Good evening. My name is DisorderFinal, and I'm a student of University of Texas, Rio Grande Valley, and I'm attending the Psychiatric Mental Health Nurse Practitioner Certificate Program, NURS. And this is my course, NURS 6261, Clinical Diagnostics for Mental Health and Substance Use Disorders. My instructor is Dr. Taze. This is my case study presentation. I chose case study number 5. I will go ahead and provide you with a very brief summary of the case study. 12-year-old Brandon was seen for psychiatric evaluation in the company of his mother due to temper tantrum, which they believed contributed to his decline in his academic performance. Brandon's academic capability was revealed by his sixth-grade teacher, who also demonstrated Brandon's poor social skills, especially not being able to establish friendship with his classmates. He frequently cries. Brandon does not trust the good intentions of his classmates, who attempts to be kind to him. He was observed yelling at other students. This case study also revealed that Brandon was bullied and he has developmental delay, spoke his first word at age 11 months, and initiated short sentences at the age of 3. After careful evaluation and looking at this case study, I chose the diagnosis of autism spectrum disorder without intellectual impairment, but accompanied with language impairment, childhood onset fluency disorder, stuttering. Okay. Before I proceed, I would like to define autistic, autism spectrum disorder, because with this definition, that might help you understand better where I'm coming from in trying to diagnosing Mr. Brandon with autism spectrum disorder. Okay, autism spectrum disorder is a neurodevelopmental condition characterized by deficits in social communication and social interactions, and by restricted, repetitive activities, behavior of interest. So that's the definition. And my rationale for diagnosing Brandon with this autism spectrum disorder is based on the DSM-5 criteria for autism spectrum. Some of which are, for instance, the criteria: persistent impairment in social communication and social interaction, restricted repetitive patterns of behavior, interests or activities as manifested by at least 2 of the following, or by history. Symptoms of the symptoms must be existing in the early developmental period, but may not become fully manifest until social demand exceed limited abilities, or maybe marks for learned approaches in later life. Unfortunately, I lost my voice. I've been trying to do this recording for days, but I thought I was getting better, but it's coming back again. So symptoms causes clinical significant impairment in social and occupational or other important areas of current functioning. These disturbances are not better explained by intellectual disabilities, intellectual developmental disorders, or global developmental delay. You see, this is the reasons, this is the criteria. So I'm looking at Brandon. He has persistent impairment in social communication skills. Um, he wasn't able to communicate to his friends. He was, he couldn't make any friends. He take things literally. Was able to unable. He was very shy. Inability to handle jokes, and he was just focused in his toys and other things he's doing. And these are all part of the symptoms of autism spectrum disorder. Now, these are the reasons I did that. I did chose that disorder, and also I also thought outside the box and did my differential diagnosis for this, and I found out that Asperger disorder is also closely related to um, autism spectrum disorder. Also, possessive developmental disorder, not otherwise specified. You know, Rich syndrome, which also has, but it's not. There's a way I ruled it out. Also, schizophrenia, attention deficit hyperactive disorder. Also, I thought about all this diagnosis, but I ruled them out for a lot of reasons. Now I'm going to go ahead and do the treatment area. In treating autistic spectrum disorder, the goal of treatment is to maximize the child's ability to function by reducing autism spectrum disorder symptoms and supporting development and learning. As we all know, early intervention and diagnosis, early diagnosis and intervention is very crucial in this area of autism spectrum disorder. It's going to help the child, you know, um, to learn and be able to function a little more, and also control those behaviors that are worrisome as they grow up. You know, um, we focus on trying to control the sensory stimuli, decreasing noises, lights, and tactile inputs. We also use some behavior and communication approaches, the therapies. Some of the use diets, medications, counseling, also group supports, family engagement and support, family therapy. A lot of mainly most of the pharmacological treatment interventions are used to control the symptoms uh, of autism. So, and in my research, I kind of stumbled around a lot of research studies. Some of them I did using my annotated bibliography. I saw that they used clonidine to target the behaviors. Also, they used a lot of good therapies. Um, I saw people using Risperdal, and other antipsychotic medications, antidepressant medications. One interest that I really picked up was the one on I saw them they used I read about using vitamin D and also omega-3. That was a very interesting part of the research, and that was it proved to be effective in some areas. As we know, every patient is different. So, but the families need help, understanding that the cues and trying to diagnose these patients early in life will help a lot in the prognosis. Um, Autism is not going away. People are getting diagnosed every day. There's a lot of people, and these days the patients live up to be very old. So the earlier we diagnose them and also intervene appropriately, that prognosis will be better. Um, and this is my references. This is a very interesting subject for me. I've learned a lot trying to dig into it. Many ways I can explain in this short distance, short period of time. with this presentation. But I really love this class, and I love the all the things work we've been doing here. I'm sorry for my voice. As I said, I've been trying for days, but now it's come. I thought I was getting better, but it's getting worse again. I continue to work on it. So thank you. I have my references here, and also any questions, my email, phone numbers available. And thank you for listening to this presentation, and I appreciate. Thank you. Bye bye.